So good evening, everyone. Welcome to our session today on nutritional challenges in seniors. Our session today is by Neerupama Mahanta ma'am. She is clinical dietitian at Apollo Hospitals in Bangalore. Before we begin today's session, for those who are new to our platform today, I'll just take some time to speak a little about Sukoon. So Sukoon Unlimited is a platform which is for the seniors by the seniors. Sukoon means peace. We are trying to build a happy community for our seniors, where uh, the seniors come here and feel happy every day. How we are trying to do this is by providing a space where we are able to share friendships that matters through our Sukoon Sarthis. They are your trusted friends. We are conducting daily events now at 5 p.m. daily, where we have our daily events, our support group sessions. We also have our industry expert session, like we have one today. We are offering support to you on speed dial, be it mental, financial, or digital well-being. We are catering to the complete 360-degree space. Then also we have various opportunities for seniors to contribute in the form of volunteering, mentorship, or conducting some workshops. So these are various things that we offer as a platform. Now I give the stage to Mahanta ma'am. Like I told, she is the host and expert for today. She is going to conduct the session on nutritional challenges on senior citizens. Also, I request all of you, in case there is any questions that you would like to ask to Nirupama ji, please feel free to pitch in, or you can also write in the chat box. I'll ask her the question on your behalf. Nirupama ma'am, you can start, please.
Sure. Thank you so much, Priya, for the introduction and good evening, everybody. I'll just share my PPT so that we can start the session. So let's begin with the today's presentation. Today we'll be talking about the nutritional challenges in senior population, and today we'll be talking about what are the key factors of the nutritional challenges that are usually seen in our older adults. The cause what are the causes to those challenges in seniors, and how we can solve those issues in our seniors. I'll just reshare again. I think there's a network issue.
Sure. So if there is an issue, ma'am, you can send it to me also. I can share if there is an issue at your end.
Sure, you can do that.
Yes, it is visible.
Yes, yes.
Go ahead, ma'am.
Sure. So I'm so sorry for the inconvenience. So let's start with this today's session. So coming to the next slide. Can we move on to the next slide, please? So aging is basically a collective change in various, physiological, psychological, and lifestyle factors over the time, resulting in progression or deterioration in the functioning. Also, there is an increased susceptibility to a disease, thereby it reduces the viability. As we age, our nutritional requirements also, changes significantly, and addressing this needs is very crucial for a healthy aging. Therefore, health education and promotion plays a very important role in maintaining good health, mobility, and independent functional status as we age. Uh, Coming to the next slide. So as we change again, there are various age-related changes which impacts our nutritional status. So first is the physiological change. Physiological is basically all the changes that occurs in our body, in our organs, and in our entire system. So first of all, there's reduced metabolic rate, which again causes alteration in our glucose levels. This puts us at a risk of insulin resistance or diabetes and other chronic illness. And the next is sarcopenia, which is basically reduced muscle mass, leading to decrease in the muscle percentage and increase in the fat percentage in our body. Other physiological changes includes certain gastrointestinal function. There's a slower digestion. Aging can also sometimes delay gastric empty, can slower motility. So most of the times, most of our seniors face a lot of issues in terms of bloating and constipation. This is because there is reduced gastrointestinal motility. And also there's reduced stomach acid production, which again limits absorption of various nutrients, for example, vitamin 12, calcium, iron, due to which these are mostly deficient in those individuals. Then next coming to the sensory declines, there's loss of taste and smell, Also, there's loss of dentures and ill-fitting dentures. There's chewing difficulty because of which they are not able to enjoy the food properly. Hence, it is very important that we modify the foods accordingly so that the nutritional status is met, and also making sure that they are enjoying the food. The next is the psychosocial factors. Wherein first is depression and anxiety, which could be again due to loss of the loved ones, decrease independence or fear of being dependent on others. Sometimes it is also due to certain cognitive decline, for example, in Alzheimer's, dementia, and they have a decreased ability to communicate with each other and leading to confusion, emotional distress, and things like those. Hence, it is important that we take care of all these things, and so that it doesn't predispose us to nutrition later in the life. Coming to the next slide, please. So next we'll be talking about the swallowing and chewing difficulties, which because this is the most common thing which is seen as we age. Uh, and almost 40% of the individuals are affected with this difficulty. So first is age-related changes, which results in reduced muscle strength and coordination. The slower reflexes and changes in the oral cavity and throat muscles. Next, it could be also due to neurological conditions, for example, stroke, Parkinson's, Alzheimer's, dementia, which again impairs the motor control for swallowing and chewing. And the next is because of certain, poor fitting dentures, missing teeth, there's gum disease, which can complicate the chewing process. It could be also due to certain medications because as we age, we develop a lot of chronic conditions, diabetes, BP, and other things. And these medications sometimes leads to dry mouth, thereby affecting the process of chewing and swallowing. So the symptoms, it's important to know what are the causes, and then next coming to the symptoms. Then symptoms includes frequent choking and coughing while eating, difficulty in swallowing solids or liquids, difficulty in controlling saliva or drooling, and frequent respiratory tract infections or pneumonia. And all these factors later in life predisposes to malnutrition because somewhere they affect the food intake and thereby affecting the nutritional status of an individual. Coming to the next slide. Yes. So in this slide, we're basically discussing about how we can manage these kind of chewing and swallowing difficulties in our adults. First is speech therapy. It is a great way as it strengthens the muscles in the throat and the mouth and improve their mobility and control. The next is dental care, which is basically taking care of the dentures and dental implants to improve the chewing ability. And the next is encourage, the third most important is the diet modification. So in the diet modification, again, there are various aspects to it. First is modifying the texture of the food. For example, modifying the food into soft, pureed, or thick consistency to reduce the risk of aspiration or choking. The next is encouraging them to take thicker liquids instead of thinner liquids to reduce the risk of aspiration. Next is to ensure small and frequent meals because they wouldn't be able to eat too much at once. So ensuring small and frequent meals or having meals every 2 to 3 hours will make sure that we are making, meeting up their nutritional requirements. Then next is nutritional adequacy, which basically means meeting the nutritional requirements with adequate food intake. And if required, oral nutrition supplements can also be initiated for them. Next is adding moisture to the food in the form of gravies, broths, etc. to keep the food moist, for which it would help in easy swallowing and things like this. Then next is avoiding risky food items which are hard, dry, or sticky. Few examples includes nuts, seeds, crackers, raw vegetables, dried breads, etc. And next is temperature consideration, which is basically foods should serve at right temperature so that it stimulates the swallow reflex. For example, soups has to be served in warm temperature and puddings at cold temperature. Next, we must also ensure that there's proper eating position, We should make sure that we are sitting at 90 degree during and after the meal to reduce the risk of aspiration. And while feeding, it is very much important that we closely monitor for any signs of aspiration. Then coming to the next slide. This slide basically, there's a short video of the things that I told. It summarizes as to how we can, maintain those kind of modifications for the adults with swallowing and chewing difficulties.
The following are suggested safe feeding strategies for persons with swallowing impairments. For specific strategies, please speak with your speech therapist. Ensure the person being fed is seated upright and is not leaning back or to one side. Check that there is adequate support so they do not slide down. They must be alert with eyes open or able to respond to conversation. Do not feed a drowsy person. It is recommended to sit next to a person when feeding them instead of standing. This is because they may tilt their head to look up at you when eating or drinking, which may lead to coughing or choking. Feed slowly, following a pace that is comfortable for them. Check to make sure they swallow each mouthful before giving the next spoonful. Avoid overloading the spoon, as this may be difficult to manage. Stop feeding when they refuse or indicate that they are full, even if they have not finished a full share. Do not force feed, as this may lead to negative feelings around meal times. Reduce distractions during meal times, including talking, as they may choke or cough when they are distracted. Monitor if they are coughing or appear to be choking when eating and drinking, as this may indicate signs of difficulty swallowing the food and drink being served. If coughing is observed, stop feeding immediately and allow the person to finish coughing and rest. Please contact your speech therapist if you have any questions or concerns.
Sure. So next we'll be talking about the nutritional challenges. So all these conditions or all these ultimately causes macro and micronutrient deficiencies in our elders. So macronutrient deficiencies is basically the deficiencies in us, for example, protein, fat, calorie deficiencies, and micronutrient are the vitamins and minerals which are required by our body in less amount. But again, those are very vitals. Next is dehydration, and both of these combine together to cause malnutrition in them later in life. Coming to the next slide, please. The previous slide, please. Yeah. So in this slide, we're talking about the nutritional specific nutrient deficiencies, which are most commonly seen in our older adults. So first is vitamin D deficiency. So all of us are mostly deficient in vitamin D because we are mostly restricted to indoors. And also in elderly, what happens is there's decreased skin synthesis, and as a result of which they have uh, lesser absorption of vitamin D, and later it predisposes to less vitamin D levels in their body, which again impacts their metabolism, causes depression, and again mood swings, things like those also happens due to vitamin D deficiency. Next is calcium deficiency. Calcium deficiency again leads to porous bones, or it again predisposes to osteoporosis. So it is important that we take calcium rich foods earlier from our life. By the age of from the age of 30, we should make sure that we are taking some kind of calcium supplements to ensure that we are taking adequate calcium through our diet. The next is vitamin B12 deficiencies, which is again because there's decreased stomach acid production, which leads to decreased absorption of vitamin B12 and iron. So most of our seniors, if you see, are anemic. That is because even though we are taking adequate amount of iron or vitamin D, B12 through our diet, it leads to decreased absorption in our body due to deficiencies. So it is important whenever you are taking anything which is rich in iron and vitamin 12, ensure you are taking vitamin C along with it. For example, if you are taking any greens, for example, spinach or amaranth leaves, things like this, include vitamin C in the form of lime juice, musambi, or orange to ensure that there's better absorption by our body. And next is protein deficiencies. Again, protein deficiency is because of a lot of changes in the diet. There's chewing difficulty due to which the intake of protein is less, and it again leads to sarcopenia or decreased muscle mass and weakness later in life. Next slide, please. So this slide basically talks about the consequences of poor nutrition. First is it definitely impacts health. There's an increased risk of infections. There's increased risk of falls in the elderly, and of course there's delayed recovery from various illness or any surgery. The next is cognitive decline. There's poor nutrition often contributes to decline in their cognitive, for example, there's confusion, there's memory loss, there's Alzheimer's, there's dementia. And the next is hospitalization. So there'll be frequent hospitalization due to nutrient deficiencies. And again, even if it is not due to certain nutrient deficiencies, if you're admitted for something else, lack of nutrition can prolong the hospital stay. So it is important that we address the nutritional requirements of our elderly. And coming to the next slide, please. So this is again certain strategies to improve the nutrition in our adults. The first is promoting a balanced diet. We must ensure that we are taking adequate calories, proteins, fats, vitamins, minerals in our diet in proper quantities. Then modifying the meal as per the requirement of an individual. If somebody is not able to eat well, if somebody has certain difficulty in eating, if somebody has certain issues with digestion, the diet has to be modified accordingly to ensure that whatever is eaten is properly digested and absorbed by the body. Next is maintaining small and frequent meals to ensure that the nutritional requirements of our individual is met. Fourth is supplementation. If required, additional supplementation with vitamins and minerals has to be there to ensure that it will not end up having any kind of vitamin or mineral deficiencies. Also, if required, starting them with any oral nutrition supplement would help. The fifth point is hydration to make sure that they are not dehydrated. So the perception of thirst is usually reduced as we age. So it is important that we take adequate and right amount of water. Also taking into consideration if anybody is suffering from any kind of other chronic illness like heart failure, renal failure, liver failure, there's definitely certain restrictions in terms of fluids. But otherwise, there has to be adequate hydration throughout the day. And next is addressing medications. We have to also see if there are any medications which can interfere with any nutrient. For example, if anybody is on blood thinners, we have to make sure that we are not giving him anything which is rich in vitamin K, otherwise it will interfere with the medication and will reduce the absorption. So it's also important that we see the medication list and give diet to the individuals to ensure that all the nutrient requirements are met. Coming to the next slide, please. So in this slide, it's basically how we can, help our seniors by encouraging them social interaction. We have to make sure that we are having our meals on time, at least one meal in a day we should ensure that everybody is having together so that they don't feel left out as they do not and then again the second is supporting meal preparation, getting them involved in preparing the recipes or grocery and things like those, which will encourage them to again eat well. They look forward to eat healthy, they look forward eat well. And next is monitoring their nutritional status, is keeping a close check on their weight on all their parameters, and doing a regular health checkup is very important to ensure that at any point of time if there's any kind of deficiency, we are able to correct it then and there. Next slide, please. So the key takeaways from today's session is basically addressing the unique nutritional requirements of elderly is very important for maintaining health, independence, and quality of life. And also proper interventions, including dietary adjustment, supplements, and support from all of us can prevent malnutrition and health-related issues in them in future. So thank you so much. That was all from my side. If there's any questions from any one of you, I'm happy to answer.
Uh, in case there is any question, you can also write in the chat section or unmute yourselves and please ask Nirupama ma'am. So, ma'am, there are a few questions. Meanwhile, the participants are asking this. There are a few questions that our community had asked earlier, which I want to
Sure.
address now.
Sure.
So are supplements necessary for older adults?
It is not a requirement that everybody has to take supplements, but in certain cases wherein their nutritional requirements are not met, or there is a requirement of a high protein, also depending on the diet of an individual. If somebody is pure vegetarian, then we would have to sometimes start them on supplements to meet up their requirements. So it is not a necessary thing for everybody, but if yes, if there is a requirement, we have to do so.
Okay, okay. Then the next question was that how much water should our elders drink daily?
So the most simple way how you can determine that how much water an individual during the you know after 50s or 60s they can drink is current body weight into 30. So if somebody is 50 kgs, so about 1.5 liters of water is what they can have throughout the day, but also taking into consideration certain other conditions. If somebody has certain heart failure or some kidney issues or liver failure, sometimes there's a restriction in water intake. So that again we have to discuss and adjust accordingly. But if for a normal individual, for a normal healthy senior, that is something that they can take into consideration and determine their water.
Okay.
I want to ask a question.
Please, sir.
How can you get vitamin D as a supplement? Just tell us about some food, or if they I know vitamin D, one dose is there for a week time, but I live in part of Bangalore where sunlight is not much for quite a
Right.
part of the year. So what foods are good for vitamin D?
Sir, foods are generally very poor sources of vitamin D. Like even if you take, they do not get absorbed. But certain foods that you can rely on are mushrooms, egg yolk. All these things have very minimal amount of vitamin D. But otherwise, if you are very deficient in vitamin D, you'll definitely have to supplement it through medications.
Okay, thank you.
Thank you, sir.
Ma'am,
If no one is asking question, can I ask one other question?
sure, sir,
Please, sir, please.
What about magnesium?
Sir, magnesium, again, you'll find a lot of magnesium in bananas, green leafy vegetables, certain seeds are rich in magnesium. So you can include all these things on a regular basis to increase your magnesium intake in your body.
Okay. Thank you.
Thank you, sir.
anyone else has any question? Okay, so ma'am, another question that had come up was how can elders improve their digestion?
So the most important thing, as we age, is definitely this decline in the digestive function, as I had mentioned. So few things that they can do is, if they have a lot of bloating and things like those, include probiotics in their diet, curd, buttermilk, things like those. Post meal walking is important, at least for 5-10 minutes. That helps for a better digestion process. And again, making sure that they are having their meals on time is important. Including fiber is important. So there are again two types of fiber: soluble and insoluble, and we need both of them. Soluble fibers are generally present in most of the fruits, apples, oats, papayas, things like those. And insoluble are again the raw vegetables, salads basically. So both has to be included in the diet to make sure that their digestive functions are proper, and there has to be probiotics included with all the meals to ensure that the digestion is happening properly. Yeah, so that should improve the digestion process.
Okay.
What about, can I ask a question?
Yes,
Sure,
yes.
sir.
I'm sorry, I'm asking so many questions. I'm myself undergoing at the age of 61, nutrition and dieting course with Karnataka State Open University. So
That's
I
a
am
good thing,
asking
sir.
all those questions. Sorry, let me ask the question. Yes, there are something like chia seed, soaked chia seed. How
Yes,
good I think that could be taken up. 1 spoon of chia seed soaked in the night and then take
yes,
morning.
yes.
It helps
Uh,
behavior.
Yes, sir. It's a very good thing. You can take that first thing in the morning, overnight, say in 1 liter or a glass of water, you can soak 1 teaspoon of chia seeds, and morning you can take. It acts as a good fiber in your body. If somebody is going through constipation, thing, fibro, hemorrhoids, things like those, it really helps. So first thing in the morning, you can have that. It is good for your stomach.
What about flaxseed?
Flax seeds are also good. You can have that only half a teaspoon per day.
Okay.
Anu,
Thank
I
you.
think whatever you are learning in your the program, they're all good for you. I have got only one, it's not a suggestion or a question. I wanted Nirupama to know that you said about getting involved in your nutrition. If the senior can get involved in his or her nutrition process. So 3 years back, that's when I was 70, I learned how to cook. Okay,
Right.
and now it has become a passion. So I fully agree with you that when I cook, I don't cook the normal day-to-day dal chawal, but something good which I would like to eat. So, and I like my children to share with me. This is a great therapy, and it has done good to me in the sense that um,
Sir, I want to tell you, uh, I had a very busy life, but I cooked right after right after I went out of my house. And today the talent lies in cooking the normal food in such a way. I do resort to cooking exotic, Italian, French, North Indian style, South Indian style. I make good sambar, good chutney also. And I make biryani and Rogan Josh, everything I make. So I want to confirm to you, the more you work on it, it's a big healer for two. I nearly involve 1.5 hour, 2 hours every day to this one. It keeps me really, it brings down the stress level quite a lot.
good to know. It's absolutely right. I share your feelings and I share your experience too. It's a great therapy, makes you feel good, makes you feel healthier. And it, for some strange reason, when I cook the food, I find it to be very, exceedingly good. I don't know
Yeah, yeah.
whether it happens
No,
with
and
everybody.
uh, actually, what the more you involve yourself and do a little bit of study, so the nutrition which we are having today, you can actually work on that nutrition. It really helps. You can take care of yourself by having some knowledge on nutrition.
Absolutely.
Thank you so much, Anup sir and Anu sir. Nirupama ji, we have a question in the chat box from Kakul ji that can you suggest some protein food for vegetarians?
Sure. So certain vegetarian foods which are high in protein would be, yeah, whole grain sprouts. Paneer is again not a very good source of protein because it has equal amount of fat also. But also what happens for vegetarian proteins is the bioavailability in our body is less. So even if you are taking 100% of vegetarian protein, it doesn't get absorbed properly. So it again becomes a challenge. But however, yeah, pulses, nuts, seeds are a very good source of vegetarian protein.
Okay. I hope that answers your question, Kakul ji.
Yeah, thanks.
Okay. Thank you so much. So, ma'am, another question I had was which food helps to sleep better, especially for our senior community?
Some herbal tea, something like chamomile, or just a simple thing by having one glass of healthy milk at night really helps with good sleep. And again, apart from that, eating well, making sure that there are no digestive issues, eating on time, drinking adequate water helps with the good sleep, definitely.
And what should our elders eat that will help to boost their immunity?
Yeah, something rich in vitamin C. So oranges, mosambis, your amlas, antioxidant rich, for example, all your fruits, vegetables, colored fruits and vegetables are very good sources of antioxidants. Kiwi, dragon fruit, things like those can be included on a regular basis to ensure that their immunity level is, maintained.
Okay, okay, thank you. We have another question in the chat box
Yes, please.
from Smita ma'am. He is asking, is food with more fiber good for dinner or for lunch?
Ideally, with high amount of fiber, lunch is a better option because as the days passes by, our body slows down. So it becomes again difficult for our body to digest very high fiber food at night. So night they can go for some soluble fibers, and lunch should be a better option.
Okay, thank you.
Can I ask
For
a
that.
question one more?
Yes, sir.
Yes, sir.
This I've been practicing that I normally take whatever I have to take for dinner. I normally finish it off before 7 o'clock, and I think
Yes.
it helps me to go to sleep at 11:30 very
Yes.
comfortably.
Yes.
So,
So that's the best practice. If we are able to have our dinner before sunset, it also helps a lot with the sleep cycle, and you will not feel any kind of discomfort. The digestion is good. Morning, you will not feel the motions are proper. Everything.
Okay. So I think we don't have any more questions coming up right now. So thank you so much, everyone, for your time today. Thank you so much, Nirupama ji. We are honored to have you here today. Thank you so much for your insightful session today. And Biju sir is also thanking you in the chat section.
Thank you, sir. Thank you, everybody for your patience.
And just for our feedback, we are taking a feedback now from all the attendees so that we are able to improve on our coming sessions. Kindly share the feedback. And I hope this session was really insightful for all of you.
It was absolutely wonderful, and it is very
Thank
good.
you so much, sir. Thank you, sir.
Great. Thank you so much, Nirupama ji. I wish good evening to you and a very good day to all of you. Have a great day ahead. Thank you so much.
Thank you.
Thank you.
Thank you, Priya.
Thank you, everyone.